Welcome to the Saskatchewan Pelvic Floor Pathway information session for women. My name is Amanda Scull and I'm the nurse practitioner at the Regina site of the Saskatchewan Pelvic Floor Pathway. We've worked very hard to create the pelvic floor pathway for a number of reasons. These are common conditions that lots of women suffer from. We wanted to break the silence. Oftentimes these are conditions that women are suffering in silence with and shouldn't need to continue on that life path. We want women to understand what's going on with their bodies and understand the condition and what's available to them for treatment options. And we also want women to have timely access to these treatment options. There was a team of us that worked to create the pelvic floor pathway. There was patient representatives who had suffered with these pelvic floor conditions. There was nurses, physical therapists, family physicians, gynecologists, and urologists. So with the goals of this presentation today, I want you to be able to understand incontinence and prolapse, discuss how the bladder works or is not working as the case may be, the anatomy of your pelvis, management options available to you with these conditions, and the next steps in the treatment process. When we're talking about incontinence, it basically means that women are leaking from their bladder when they don't want to. About a third of women sometimes leak from the bladder involuntarily. The bladder is not a particularly smart organ. It's normally just meant for storage. So it's a smooth muscular structure that is meant to fill up with urine and contract down at the appropriate time, giving you the sensation that you need to empty your bladder or void. Incontinence can worsen over time due to other factors such as childbirth, aging, diabetes, or other conditions that affect the nerves, and effects of medications or radiation therapy. There are two main reasons why women leak urine: stress incontinence or urge incontinence. Stress incontinence means that you leak urine when you put physical pressure on your bladder. Stress incontinence is caused from pressure outside the bladder. Common triggers include coughing, sneezing, jogging, a sudden jolt, lifting, exercise. It's more common in women than in men, and it's related to a lack of support of the bladder and urethra. Urge incontinence means that you feel like you urgently need to empty your bladder, even when it isn't full. You may leak urine before you get to the bathroom. This can also be called an overactive bladder. So urge incontinence, people will often complain of common triggers, such as hearing water, cold weather, standing up. This often happens at night or when you get up in the morning and you can't make it to the bathroom without emptying your bladder on the way. This is actually where the bladder muscle itself is misbehaving and contracting down inappropriately. So the treatment that we have to offer is targeted at the bladder muscle itself. Oftentimes, women will struggle with both stress and urge incontinence. It's very good to have an appreciation of which kind you're struggling with, because causes and the treatment options are different. What is fecal incontinence? Some people are also leaking contents from their bowels, such as gas, liquid, or solid stool. Fecal and urinary incontinence often occur together because of pelvic floor muscle weakness. Fecal incontinence can improve with dietary changes to improve the stool consistency, pelvic floor muscle strengthening, and correct toileting techniques. The pelvic floor pathway has trained professionals who can help. Vaginal prolapse is another common pelvic floor complaint. A vaginal prolapse can happen when the tissue and muscles inside the pelvis become weak. This weakness allows the vagina, uterus, bowel, or bladder to come down. First, we're going to look at what a uterine prolapse occurs. So to the left of the screen is the front of your body where your bladder is, and to the right of the screen is the back of your body where your rectum is. Up at the top, you can see clearly labeled your uterus and where it should normally sit. When we talk about a prolapse, it can happen in varying degrees, but it basically begins to descend into the vagina, closer towards the outside of your body. An anterior prolapse, or a cystocele, involves the bladder coming down into the vagina. As you can see, it's again to the left of your screen, sitting where it normally should. And as it begins to descend into the vagina, we get varying degrees of pelvic organ prolapse, or cystocele. There can also be prolapse from the back vaginal wall of the rectum And you can see there it's sitting where it normally should sit. And as this pushes into the back vaginal wall, that can also cause a bulge into the vagina. Sometimes women will have a combination of all three. Vaginal prolapse can feel like a bulge or pressure between the legs. It can affect your bladder, bowel, or sexual function, and it can be uncomfortable. You may notice that a prolapse feels bigger if you lift something heavy, if you have a chronic cough, if you strain with bowel movements, or on the days where you may be on your feet a lot. Now let's move to talking about management options. Incontinence and prolapse can be treated in a variety of ways, including self-management, which we'll talk about further, pelvic floor physical therapy, medications, pessary, and surgery. Self-management. Oftentimes women may choose to manage their incontinence and prolapse symptoms themselves. Making some simple lifestyle changes and learning self-management tools can help you to improve your condition. A doctor, nurse, or physical therapist can give you more information. Some of the lifestyle changes that can help with these pelvic floor complaints that can improve incontinence and prolapse include achieving a healthy body weight. Any extra weight that we carry around puts extra pressure and work on those small pelvic floor muscles. There are a small group of muscles that are providing support to all of your pelvic organs and providing control for both your bladder and your bowel. Any extra weight we carry around gives them extra jobs to do and makes them less capable of directing energy to giving you good support for your pelvic organs and good control for the bladder and the bowels. Eating well and getting regular exercise are key pieces of maintaining a healthy body weight. Drinking 6 to 8 glasses of fluid per day can make all the difference for how your bladder behaves. Sometimes when women are struggling with incontinence, the tendency is to drink too little, so they limit their fluid, and what happens with that is you end up with strong concentrated urine that irritates the bladder and increases episodes of urgency and incontinence. Sometimes women are drinking much too much fluid for their body to be able to deal with. Anything significantly more than 8 glasses a day is just more than your bladder can handle and is contributing to issues with incontinence. Avoiding constipation is another key piece of the puzzle. If you end up struggling with constipation, those pelvic floor muscles have to provide support to a hard constipated stool and control, and they're less capable of giving you as excellent control for the bladder. With urge incontinence, you can also try regular toileting every 2 to 3 hours. It's very important to make sure that your bladder is getting emptied regularly and completely. Sometimes repositioning or double voiding, where you actually stand up and sit back down, can make all the difference. Your bladder doesn't get over full and you're less likely to leak with cough or laugh or sneeze or an urge. Avoiding things like caffeine, alcohol, and cigarettes, which act as irritants to the bladder, can also make a huge improvement. We like people to be aware of what they're eating and drinking and how it impacts their bladder. Sometimes there's irritants in your diet that you're not even aware of. Some other common things that we see that irritate women's bladders and make their incontinence worse can be things like vinegar, citrus fruits, tomato, and artificial sweeteners. With stress incontinence, lifestyle changes may include choosing lower impact physical activities. For example, choosing walking instead of running until you can get some more pelvic floor strength. Let's talk a little further about caffeine, because often we're unaware of how much caffeinated beverage or other products we're actually consuming. There are a list here of many of the common offenders for caffeine. Oftentimes people don't realize how much caffeine they have in a day, and that is negatively impacting your bladder for a full 24 hours. Some of the caffeine, about 25% that you consume even with a morning beverage, is still with you for 24 hours and is negatively impacting how your bladder behaves. We always recommend a trial of slowing down your caffeine intake. Just gradually cut yourself off to a point where you can give yourself a week or 2 of complete caffeine-free trial just to see how much better things are. Some other tools for self-management include pelvic floor muscle exercises, which are also called Kegels, bladder retraining, freeze and squeeze techniques for preventing leaks. So when we talk further about those, the pelvic floor is a group of muscles, again, that provide support to your pelvic organs and to prevent prolapse, and it helps to keep the bladder and bowel closed to prevent incontinence. So you can see on the left side of the screen is the front of your body and your bladder, and on the right side of the screen is the back of your body and your bowels. Those dark shaded in area are your pelvic floor muscles with an attachment to the pubic symphysis bone at the front and an attachment to the coccyx or your tailbone at the back. So everyone can try this right now. Imagine that you're trying to stop the flow of urine or trying not to pass gas. So you should feel your vagina and anus tighten, and you should be able to try and hold this contraction for about 3 to 5 seconds. So it's really important to isolate those muscles, that you're not holding your breath, and that you don't tighten any other muscles such as your abdomen or your buttocks. So you try and relax the rest of your body and just isolate and squeeze those muscles. So you should be able to increase the length of the hold as you get stronger. We often encourage women to try and do at least 30 of those a day. Sometimes it's easier if you break them up. Maybe think about doing 10 every time you have a meal, or 15 in the morning before you get out of bed, and 15 in the evening before you go to sleep. If you can find a way to make it part of your habit, it tends to make it easier to remember. So it's important to do those pelvic floor muscle exercises correctly, or you may not see results. In order to test yourself, and this is just a test, this isn't how we want you to do them all of the time, you can try and stop the stream of urine in the middle of urinating, or you can place a finger or two into the vagina and squeeze the pelvic floor muscles. You'll actually feel a tightening around your fingers if you're using the muscles correctly. For stress incontinence, you can practice something that we like to call the knack. So you squeeze your pelvic floor muscles before an increase in intra-abdominal pressure, such as a cough, a laugh, or sneeze. So on the left of the screen, you can see what happens when you cough with weak pelvic floor muscles. The pink shaded area is a representation of the pelvic floor muscles, and you can see that there's a lot of pressure down and everything kind of just sags and bulges with the cough. On the right, you can see that coughing with strong pelvic floor muscles, everything is much more supported and there's less sag down. So the knack, when you're squeezing at the same time as you're having the activities that make you squeeze, that make you leak, is going to increase the amount of support that your pelvic floor muscles are able to provide and the amount of control that you have for your bladder. Let's talk about bladder retraining, the urge curve. Oftentimes we don't realize that the urge to urinate will pass. We've kind of been trained that we think we are going to get that urge to pee until we actually make it to a washroom, and that's just not the case. That urgency that we feel is actually just the bladder muscle contracting down, and no muscle contraction lasts forever. So what typically happens is it starts, and you start to notice that you have to go to the washroom. That urge increases or grows, and you can squeeze those pelvic floor muscles at that point in time. It's going to peak, that point where you're like, holy smokes, I need to make it to a washroom. And at that point, lots of women find it helpful to distract themselves. So maybe they count backwards from 10, or they repeat a nursery rhyme in their heads. At this point, that urge is going to start to ease off or relax. And at point, you need to just wait, continuing to squeeze. And when the urge passes, that's when you can safely make it to the washroom. So this is what we call freeze and squeeze. So you're going to deny that natural urge to rush to the washroom as soon as you need to pee, and wait until that urge passes while squeezing your pelvic floor muscles. So to practice the freeze and squeeze, you can squeeze your pelvic floor muscles when you have a trigger for urge incontinence. This is different for every woman, but commonly it's running water, getting home, putting the key in the door and unlocking it. With practice, you can actually train your muscles so that they respond automatically. For both freeze and squeeze techniques and the knack, they work better the stronger your pelvic floor muscles are. So this is something that you need to work on strengthening with those Kegel exercises we talked about earlier, and it's going to get better over the course of time as you gain more strength. We typically tell women that it takes about 3 to 6 months before they notice how much improvement they're going to be able to get from having a strong pelvic floor. And it's important that they're motivated and that they're persistent, because if they get to a point where they're very satisfied with the results and they stop doing their exercises, they're going to lose all of that benefit. So self-management requires time and patience and may not stop leaking 100%. Some women feel confident that they can work independently on these changes and exercises and other tools. So in summary, for self-care, with urge incontinence, fluid management, again, we like to focus on that 6 to 8 total cups of fluid a day, with at least 2/3 of that being water. Elimination of irritants, including caffeine. A trial of caffeine-free is most helpful. And paying attention to what you're eating and drinking and how that impacts how your bladder is behaving or misbehaving. Scheduled voiding or time toileting every 2 to 3 hours, emptying completely during your waking hours. Pelvic floor strengthening with those Kegel exercises. Shoot for at least 30 a day and know that it's going to take 3 to 6 months before you notice full benefit. And urge suppression, using the pelvic floor muscles as they get stronger to freeze and squeeze. For stress incontinence, choosing lower impact physical activities, pelvic floor strengthening, and avoiding incontinence using the neck. So squeezing those pelvic floor muscles at the same time that you're coughing, laughing, sneezing, those sorts of activities that are causing you to have episodes of leakage. So pelvic floor physical therapy is available through the Pelvic Floor Pathway and also through many community providers. So women with a very weak pelvic floor may have difficulty isolating pelvic floor muscles or doing pelvic floor exercises correctly. Specially trained physical therapists offer individual coaching and support. Physical therapists provide individual assessment and treatment for such things including correct performance of pelvic floor muscle exercises, techniques for controlling incontinence, education about posture and toileting, home exercise programs, information and support for lifestyle changes. The therapist may occasionally need to use additional equipment. They sometimes use biofeedback machines to show how hard muscles are squeezing, which is helpful for some women who have difficulty isolating those pelvic floor muscles, or electrical muscle stimulation to help you isolate and identify your pelvic floor muscles. They may show you how to use vaginal weights or cones to increase pelvic floor strength. This is particularly helpful with stress incontinence, and these devices are not recommended for women with prolapse. 60 to 75% of women who participate in pelvic floor physical therapy programs are very satisfied with the results. We know that you must continue with the exercises and lifestyle changes or those symptoms will return. So pelvic floor physical therapy is available again in both pelvic floor pathway clinics in Regina and Saskatoon. It may also be offered locally by your health region and by private physical therapists. If you choose a private physical therapist, the cost will not be covered by your Saskatchewan health insurance. Medications are available for urge incontinence. They work to relax the overactive bladder and reduce unwanted bladder contractions. Medications are not available for stress incontinence and prolapse, and medications can be prescribed for you by a physician or nurse practitioner. Some women have a very good response to medication and others see no difference. You should see a difference in a few days with some of the medication, and some of the medications can actually take up to a month before we see improvement. Episodes of incontinence may decrease by about 50 to 60%. There are a lot of different medications are available, and this is a bit of a moving target. Every time I think I've got a good grasp on everything that's out there, they add another medication into the mix, which is good for you because it means that you have more options. It's not uncommon when we try a medication that it's not the perfect one the first time or maybe even the second time, which is nice to have other options. Some women have to try several medications before they find the best one for them. Some of the medications are fast-acting and only last about 8 hours. Most of the newer medications last for a full 24 hours and are going to take about a month of use before you know how much improvement you're going to get. For most women, symptoms do return when they stop taking medications. There are occasional women who find that they are able to stop medications, however, by using the pelvic floor muscle techniques and the lifestyle changes that were previously mentioned. So there are side effects with most medications, and the side effects that we commonly see with these medications include dry mouth or dry eyes, constipation or nausea for some women, and blurred vision, which is a rare but bothersome side effect. Any of the side effects will go away within a short period of time, usually a day or two after you stop taking the medications. A pessary is another treatment option. It's a silicone disc or ring that can be specially fitted for you by a doctor or a nurse. They're very helpful for vaginal prolapse, so they can be worn to support the pelvic organs and eliminate the bulge between your legs. Stress incontinence. About 2/3 of women find that a pessary is helpful for stress incontinence. So the pessary is inserted into the vagina like a tampon. If it fits you properly, you don't feel it. You notice it going in and coming out, but you won't actually notice it when it's fitted in there. At the Pelvic Floor Pathway, we do teach women how to insert and remove their own pessaries for management. Out in the community, different providers may manage things differently and have you come back into the office to have them removed and cleaned. So the pessary can be left in for several days or used simply as needed. I've got lots of patients who just prefer to wear their pessary for certain physical activities, like a soccer game every couple of days or that sort of thing, or lots of women who use them on a regular basis. Your pessary should be removed at least once or twice a week overnight to give the vagina a break. You would need to remove your pessary for sexual intercourse. And if you wear the pessary all of the time and you're postmenopausal, local estrogen can help prevent with irritation. Surgery is available for stress incontinence or for vaginal prolapse. The surgery is not meant to treat urge incontinence. If you are interested in surgery, you will meet with a surgeon to discuss your condition, and your surgeon will describe the option that is best for you. The surgery for stress incontinence in normal cases is performed as a day surgery with local or regional anesthetic. Most women are back to work in about 2 to 4 weeks, and 85 to 90% of women will experience improvement or cure. The surgery for vaginal prolapse is a little more involved, and it really depends on the organs that need to be repaired. Patients typically stay in the hospital for 1 to 3 days, and you should avoid heavy work for 6 weeks. 70% of patients will experience long-term cure. So surgical risks for prolapse surgery and stress incontinence surgery may rarely cause difficulty urinating, unpredictable effect on urge incontinence, pain with intercourse, need for revision if the vaginal tissue stretches again, and need for removal of mesh due to pain or exposure from the mesh. So in summary, urge incontinence has available for treatment self-care, pelvic floor physical therapy or medications. Stress incontinence and/or prolapse, you've got the option to choose self-care, pelvic floor physical therapy, pessary, or surgery. So what are the next steps from here? Treatment or not. Incontinence and prolapse are not life-threatening conditions, so it's important that you think about how much this is bothersome to you. Do your symptoms affect your ability to work, to exercise, your ability to do things that you enjoy, or your emotional health, self-esteem, anxiety? If you decide to seek treatment, the next step is assessment. You can be assessed and diagnosed by your doctor or nurse practitioner, a gynecologist or urologist, or a pelvic floor pathway clinic in Regina or Saskatoon with a referral from your primary care provider. Your healthcare provider will ask you for information about your medical history, your symptoms, and your full cooperation is required to provide this information. Your provider may ask you to keep a bladder diary. You can use it to record how much you drink and how much you urinate for 3 days. This is incredibly important information for us when we're trying to sort through exactly what is going on with you and how we can best help you. So you record such things as the time of day, any drinks that you're having, what you're drinking, and the amount, any urine that you voided in the toilet. So you will be required to measure all of your voids for 3 days, typically. Any urine leakage, whether that's small, medium, or large, and the reason for the leakage. So your healthcare provider will go over your medical history, discuss your problem with you, perform a targeted physical exam, including a pelvic examination, to assess for prolapse and pelvic floor muscle strength. The healthcare provider will help you compare treatment options that are open to you and choose from pelvic floor physical therapy, pessary, medication, or surgery. Whatever treatment option you choose will involve more appointments, may require more detailed tests and pelvic examinations, and may involve some costs not covered by public health insurance. May involve wait times for some of the programs. So this slide is just to direct you to the Saskatchewan Pelvic Floor Pathway website, where you can get further information. Just bear in mind that the right treatment is the one that feels right to you. Advice and treatment are always available to you. You're not alone in your struggle with these conditions. And if you're interested in assessment, please contact your doctor or nurse practitioner. Thanks for your attention.